The Neurogenic Bladder Research Group is really a collaboration of multiple different institutions and people, all with the goal of bettering the care for people with a neurogenic bladder. And we really sat down and said, well, we can make a difference in this by trying to form a group of looking at this collaboratively, and that was the nucleus of the Neurogenic Bladder Research Group.
We're all very passionate about different aspects of how we can improve neurogenic bladder. For instance, some of us are very passionate about health policy or public health, or we have clinician trialists, we have basic scientists, we have translational scientists. It's like a lot of different individuals with the same goal, but unique backgrounds, unique interests come together to help neurogenic bladder research and neurogenic bladder health.
So I think one of the most important things to understand about NBRG is that we are a research organization, so our primary goal is looking at generating patient-centered, relevant research in the field of neurogenic lower urinary tract dysfunction. And that's been an area that traditionally has not had a lot of patient-centered study, and something that we're really focused on as a group in developing over the last decade.
One of our first studies that we undertook was a research grant funded by the Patient-Centered Outcomes Research Institute, or otherwise known as PCORI. The goal of the PCORI study was to survey patients with spinal cord injury across the entire country and ask them about how their bladder management impacted their quality of life. And our goal was really to understand whether or not different types of bladder management practices were associated with an improved quality of life related to the bladder versus a worsened quality of life.
And NBRG was able to take that data and come out with some very interesting findings. Many of those were things such as patients prefer suprapubic tubes as opposed to clean intermittent catheterization, even though we as urologists think that clean intermittent catheterization is the gold standard. As to why patients prefer suprapubic tubes is something that's an ongoing investigation, but we would never even thought about looking into that had we not done that research.
One of the things that we recognized when we formed NBRG was that many other specialties in urology have done an excellent job at forming consortiums that really help to push the literature forward. And in neurogenic bladder management, we didn't really have that type of consortium. And so forming NBRG, we wanted to be able to leverage lots of different diverse locations and pool our data together to really push the envelope on understanding how to manage patients with neurogenic lower urinary tract dysfunction.
So the meetings or think tanks that NBRG runs are a really excellent opportunity for people to come together from across the country to sit down and share ideas. We usually try and run them around a theme so that we can focus on a particular area and start to think in depth about what research exists in that area, what the gaps are, and how we as a group can start thinking about projects that will inform those gaps.
In order to address some of the gaps in neurogenic lower urinary tract dysfunction, I think one of the real strengths of NBRG is bringing together different people from different institutions and from different medical backgrounds in order to try to solve some of these problems and really address these gaps in a multidisciplinary way.
Our group is very open to seeking out new ideas, to looking and evaluating new innovations within the field, being on new surgeries, new techniques, or even improvements in our old techniques, new catheters, new bags, new modalities that evaluate the diagnosis, the prognosis, and the therapies for neurogenic bladder.
It has a really good track record as a group of formulating and publishing projects, so they are established. But as a group, we also recognize that we need to be sustainable, we need to have a future, and so we're actively looking and encouraging people who are interested in this type of work to become part of the group, to really add new energy, new ideas, and to keep fueling things as we go forward.
The NBRG group's really been critical to establish partnerships and relationships with colleagues in neurourology across many different centers. For myself, coming from a smaller center where there aren't as many neurourologists, this has been essential for me to be able to develop my research ideas and to be able to launch collaborative projects.
Now that we have this collaborative group of surgeons together, we can actually assess our outcomes, the way we've been doing it, and how we have to change it moving forward. So we're doing prospective studies on surgeries that are very uncommonly done, putting it all together, making adjustments to our procedures, and hopefully providing better guidelines and better instructions for clinicians who care for neurogenic bladder patients.
I think one of the strengths of NBRG is really the individual members both bringing their individual perspective, but their willingness to collaborate and to discuss. And we're all kind of anchored by the mission of improving the health and the lives of the people with this condition. But the journey of us being able to discuss and work together is really, I think, what makes the process move forward with it. And it's just so vital to kind of both the future of the group and then also kind of the work that we do.